Dr. Ho, what are some tests for coronary heart disease?
Okay. Well, you know, it's when you see your primary care physician or your cardiologist, usually we risk stratify you based upon your risk, and usually the test that's indicated is indicative of what kind of risk you have. Certainly, you know, if you're real young and athletic, we would get you on a treadmill, and that would simulate an increase in cardiac output, and we try to get you to, if you have any blockage in the blood vessels that supply your heart, certainly you'll manifest some of those symptoms of chest pain that we talked about earlier. And some of the tests include, you know, plain old treadmill where they put you on a treadmill and they run you, and they have these electrodes, an EKG that monitors you and checks for any kind of abnormalities, whether arrhythmias or ST elevation or depression, depending on whether you have blockages. Some of the other tests include, you know, thallium studies, nuclear studies, and those modalities involve giving you medication through the IV, and they put you in a scanner, and in doing so, we're able to see whether you have blockages in the blood vessels that supply your heart based upon the distribution of the heart. So that's another modality, and there's other modalities that include giving you medications that will speed up your heart, and we can do ultrasound of your heart at the same time before and after exercise or simulated exercise with dopamine, for example, and that will show whether the wall of your heart moves in a certain way, and if it is slowed after exercise, that would indicate that you're not getting adequate flow to those areas. So that's kind of the gist of some of the stress tests that we have, and they're very important in complementing both the clinical aspect as well as you know, treating coronary heart disease.
Oh, thank you.